Did you know that it's estimated that shockingly 2 out of every 3 obese persons have osteoarthritis? Also known as degenerative joint disease, it's a condition often caused by wear and tear and the gradual loss of cartilage at the ends of the bones that cushion the joint. This cartilage deterioration typically progresses over time and can eventually lead to disability. The most common symptoms include knee pain that starts gradually and worsens with activity, stiffness, swelling, and discomfort after sitting for long periods or resting. As the condition progresses, pain tends to intensify and function can become increasingly limited. Currently, there are no proven disease-modifying treatments for osteoarthritis, making effective management and prevention crucial. And when it comes to both the joint most impacted by osteoarthritis and the one with the biggest negative consequences on disability, healthcare costs, and quality of life, the knee stands out, accounting for over 80% of the total burden of the disease. That's why today we wanted to explore the impact it is having in Ireland. But first, as always, please take note of our disclaimer. Unfortunately, there is limited data on knee osteoarthritis in Irish overweight populations. But to provide a reasonable estimate of its prevalence in Ireland, we can use available demographic and epidemiological data. In 2024, the total population of the Republic of Ireland was approximately 5.38 million, with around 4.18 million being adults. In 2019, 23% of Irish adults were classified as obese. So given that 2 out of every 3 obese adults develop osteoarthritis, like we pointed out at the onset, we estimate that around 640,220 obese adults in Ireland may have some form of OA. Then, to estimate the proportion of osteoarthritis cases that are specifically involved in knee, we can refer to a stacked bar chart that visualizes the distribution of OA types across different regions globally. Examining the Western Europe region in the chart, knee osteoarthritis, represented by blue, appears to account for over 50% of all osteoarthritis cases, while the hand, hip, and other forms of OA make up the remainder. Although the study does not provide an exact percentage, using this 50% estimate, we can reasonably approximate that at least 320,000 obese Irish adults are currently living with knee osteoarthritis, representing approximately 6% of the adult population in Ireland. And keep in mind, this estimate does not include people who are overweight but not obese, meaning the actual number of individuals affected by knee osteoarthritis is likely even higher. When discussing obesity, it's important to clarify a common misunderstanding. Many people misinterpret what it means to be obese, often picturing extreme cases like individuals who are bedridden, immobile, and reliant on a CPAP machine, for instance. However, obesity is far more common and not always as visually extreme as people assume. Many obese individuals don't even realize they are obese. For example, research shows that only about 1 in 4 women and 1 in 14 men correctly identify themselves as obese. They just think that they're overweight. This is a huge problem in its own right, as if people aren't aware of this, they are less likely to recognize the increased health risks associated with it, making them less motivated to take action. Anyway, I just wanted to emphasize that obesity is far more common than many people realize because it's important when we are talking about weight-related knee osteoarthritis. Again, 1 in 4 adults in Ireland are classified as obese. Another important point to consider is that the risk of osteoarthritis for the knee increases with weight gain, not just for those who are obese, but also for people who are overweight. The risk doesn't suddenly begin at obesity. It starts rising even before reaching that threshold. One study suggests that for every 5-unit increase in BMI, the risk of developing knee OA increases by 35%. Using this as a guide, we can estimate the increased risk for different weight classifications. People who are overweight have a 35% increased risk of developing knee osteoarthritis. For those with class 1 obesity, a BMI between 30 and 34.9, the risk jumps to around 82% higher. In class 2 obesity, BMI 35 to 39.9, the risk increases even further to about 146%, and for individuals with class 3 obesity, a BMI of 40 or higher, the risk skyrockets to roughly 232% higher. This highlights how even modest weight gain significantly increases the likelihood of developing knee OA, reinforcing the importance of weight management for joint health. But how does weight gain influence knee OA exactly? But just on a quick side note, if you would like to undertake our evidence-based and results-backed personalized plateau weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. The most obvious way weight gain contributes to knee OA is through added mechanical load. More body weight means greater pressure on the knee joints, leading to faster wear and tear of cartilage. Research suggests that each additional kilogram of body weight increases the compressive load on the knee joint by approximately 4 kilograms during activity. However, what's less obvious is how metabolic factors associated with excess fat also contribute to knee OA. For a long time, fat tissue was thought to be just passive energy storage, so knee osteoarthritis in overweight individuals was assumed to be purely a result of mechanical stress. However, recent research shows that fat tissue is actually a metabolic and endocrine organ. If you search "is fat considered an organ" on Google, you'll see that the answer is yes. Fat tissue secretes inflammatory substances such as leptin, resistin, and adiponectin. These molecules are particularly relevant to OA because they directly impact cartilage health and may contribute to joint deterioration independent of mechanical stress. This also explains why obese individuals have a higher risk of developing hand osteoarthritis, even though the hands are not weight-bearing joints. Beyond mechanical stress and metabolic factors, there may be other, deeper underlying causes of knee OA, but they remain unclear and poorly studied. Okay, so why the need to tackle this problem? As obesity rates continue to rise, the incidence of knee OA is expected to increase significantly, with a projected 74.9% rise in knee OA cases by 2050. The link between obesity and knee OA underscores the need for effective management, especially in light of the obesity epidemic. Knee OA not only causes physical symptoms such as pain, stiffness, and swelling, but also contributes to mental health issues, with 30% of patients reporting depression and 27% experiencing anxiety. Additionally, knee OA is linked to higher levels of cardiovascular mortality, falls, and atherosclerosis-related conditions. Weight gain further predisposes individuals to total knee replacements, a procedure with a 43% obesity-related incidence. While total knee replacements are effective, complications such as infection, instability, and dissatisfaction can occur. Obesity increases surgical risks, including wound complications and medical issues like kidney injury. Financially, the burden of knee OA is substantial as well, with direct medical costs, including hospitalization and therapies, making up 1 to 2.5% of gross national product in developed countries. The total annual cost of knee and hip OA in Europe averages over $6,600 per person, encompassing both direct and indirect costs. This highlights the urgent need for proactive, combined interventions. Have you weight-related knee osteoarthritis? What was your experiences with it being? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.